Hello, my name is Ryan Terlau. I'm one of the plastic surgeons at Muskegon Surgical Associates. Today I'm here to talk about finger amputations and nerve pain. So finger amputations is a common thing to happen from trauma, from work, from your hobbies, and we unfortunately see quite a few of them. And so typically after having hand trauma like this, you need to present to either the office to see a hand surgeon or to the emergency room to seek care. One of the most initial things is getting a clean wound, and so it needs to be irrigated, it needs to be washed, and then it needs to be closed. Occasionally that requires us to shorten the fingertip, and after that occurs, people sometimes have what they call phantom or nerve pain. And that often presents after a shortened finger. If you tap that finger on the table, or if you hit a particular spot on that finger, you get an electric type shock shooting up the hand. Or you have the sensation that that part of the finger is no longer there. So having a neuroma or phantom pain is quite common after a finger amputation or a finger injury. The way to take care of these problems, there are two. We typically try and get the swelling down after an injury like this by placing digital caps. So they're little silicone sleeves that help get the swelling out of the finger and help desensitize the finger itself. We often have you see the hand therapist for desensitization therapy, and this helps the sensitive tip of the finger or the injury become less sensitive over time as your brain relearns what's the new normal. If that does not work, there are several surgical modalities to deal with the nerve pain or the phantom pain that you may have. So if you do have a painful end of a nerve, we often try and get rid of the nerve that's in the scar tissue and place it somewhere else. If it's in the finger, we typically try and shorten the nerve so that the nerve is away from the scar tissue and do what they call a neurectomy. If you have a more proximal amputation, let's say within the hand, and you still have the sensation that the finger is still there, then we'll do something different called targeted muscle reinnervation or regenerative peripheral nerve interfaces. And the way we deal with this is we try and find a target for that amputated nerve to grow back into. So instead of the nerve trying to find the amputated end, the nerve is now placed into a free muscle graft or into another nerve. And this typically helps with that pain and gets rid of the sensation that the finger is no longer there. These cases are quite variable, and the injuries are quite variable as well. Every case is different, but if you do have a painful finger or think you have a neuroma or have had a traumatic amputation, we're happy to see you in the office and discuss your case.